The idea that somebody could have a normal pituitary gland, 2 testicles, and still have low levels of testosterone and have that affect their lives, that was not known. It was not known. Nobody was doing that work. And because of the fear of prostate cancer, it was actually kind of scary for me to do that. And it was really just trying to solve a problem with patients. But what happened over time is, and so I became very careful around testosterone and the prostate, and I did some research around that. And the end of that story is that today, 30 plus years later, today we know that testosterone doesn't cause prostate cancer like we thought that it did. And that in fact, there are many men even who have prostate cancer who have been successfully treated with testosterone without there appearing to be an increased risk. That's what we know today based on the evidence. But it took a while for anyone to start figuring out that these men actually might benefit in a whole variety of ways, as today we know. So testosterone is not just about sex. It's about muscle and fat and sense of well-being and mood and energy and a sense of vitality.
I do want to unpack with you some of the prostate misconceptions, cardiovascular misconceptions, and even I think lack of awareness around the quality of life improvements. But kind of taking it back first to the prostate component, isn't it also potential that men with very low androgen levels have equally as much, if not potentially greater health risks outside of not just the prostate, but just looking at their total health compared to someone who does have essentially optimal or levels within the physiological reference range?
Right. When I started this, I had no idea what I was getting into. I was just trying things, trying to help my patients. And it was new. It was kind of exciting. It was very scary because I was afraid I was going to give some of these men prostate cancer. And I was a young doctor. I'm not so young anymore. And I've been working in this field now on some level for 40 years. And where I've come to is the realization that mainstream medicine doesn't quite get it yet. They don't get the importance of testosterone deficiency on the lives and health of men, and they don't understand really the benefits of testosterone for many of those men. There's a skepticism that stops a lot of doctors from even considering it. There's a bad rap that testosterone has around prostate cancer and cardiovascular disease that's not merited if you look at the real data. And we've kind of let it go. And the impact of it is that there are literally millions of men in this country who are walking around testosterone deficient, who are unhappy with their lives, or who have medical issues affecting their lives, where there is a treatment that could help them tremendously, and their doctors don't know about it, or they don't want to go there. And I've been working now trying to educate physicians for decades now. And we're making gains, but there's still a long way to go.
It still seems like there's so much bias in the space, or just complete lack of awareness when it comes to testosterone utilization. And so you mentioned all of these millions of men that are potentially suffering because they're not the foremost expert on their health. They're not testosterone experts. They're just essentially experts on their lives, but they don't necessarily know that the solution is out there. What do you think are the next steps in terms of accessibility and really making sure that this is something that becomes a more mainstream conversation or just more acceptable for people to understand that these hormonal interventions or potential hormonal therapies are not only safe, but life-changing?
I see the potential for much greater health for men across this country. Health and, I hate to put it in a medical context, it's not really a medical term, happiness.
Right.
I think there's the potential for men to feel better within their bodies. And when men feel that way, they're kinder and more generous to everyone around them. When men are deficient in testosterone, the body is struggling. It's a reduced state of the human condition. Now, there are people who have mild levels of reduced testosterone who don't have that many symptoms. I'm not really talking about those men. But there are a lot of men who are really very substantially affected by their low levels of testosterone.